Frozen shoulder is most likely to happen to women during the perimenopause-menopause transition, and it is not just happen chance. You see, estrogen is protective of so many things, but you probably didn't realize estrogen is protective of your joints, your muscles, your tendons, your ligaments, your bones, all these things. And this is why me, a women's health physical therapist, talks about perimenopause and menopause and screens for perimenopause in my patients, because frozen shoulder is quintessential perimenopause orthopedic injury. And let me tell you why. So there's two types of frozen shoulder, primary and secondary. Primary frozen shoulder is what I'm going to be talking about for perimenopause, because that's the one that is chemically affected. Secondary frozen shoulder happens when there's an underlying orthopedic injury like rotator cuff tendonitis, bicep tear, slap tear, labral tear. There's an orthopedic injury happening. The chemical side is the primary hormonal perimenopause, menopause, thyropause, hell. So anywho, the adhesive capsulitis that you're speaking of is that your shoulder capsule, think saran wrap that surrounds your joint, has a thickening on the front part, which is called your anterior side of the capsule. Remember, the saran wrap went around a little too much here, and then you get a thickening, see, a thickening, a fibrosis and shrinking of the capsule. Now, what we also know is there is a coracohumeral ligament, which goes from this little thumb-like appendage, the coracoid, to the humerus. And under that coracohumeral ligament is the long head of your bicep. So this is why you get this referral anterior terrible pain. So you get a thickening of your capsule, and ligaments are technically thickenings of the capsule. We specifically know the coracohumeral ligament is a squirrely little thing. So for you having frozen shoulder, your estrogen was helping protect the health of your joints, your lubrication of your joints. Now, physical therapists like myself that do women's health know that hormones affect frozen shoulder, and this is one of the things I screen for. But Duke, in October of 2022, and this was presented at the Menopause Society, she, out of Duke, found that there is a connection between estrogen and frozen shoulder in menopausal women. And this lady found that postmenopausal women on hormone replacement therapy had a lower risk of developing painful shoulder condition called frozen shoulder. And the women that didn't take HRT hormones were more likely to get frozen shoulder. But here's what you need to know. Estrogen plays a role in stimulating bone growth, reducing inflammation, and promoting connective tissue integrity. It keeps it flexible, it keeps it plump, it keeps it beautiful and lovely like your skin and hair. You already know that. So she's talking to us about the fact that estrogen matters, which if you haven't read the book, Estrogen Matters, it all makes sense then. So this wonderful research study gained credibility, got traffic in the media, but not all doctors know this. So for my people that I see, if I am screening you for perimenopause and I have found you have a frozen shoulder, I'm going to refer you to your primary care physician, because research has shown that your primary care physician is a great advocate and does know how to treat frozen shoulder. You will then see your doctor, and hopefully they will refer you to someone like me, a physical therapist, an orthopedic surgeon, if need be, to have other injuries ruled out. Because remember, we want to make sure you don't have a secondary frozen shoulder and have some other issues. But they're going to help you determine what is happening, chemical issues, mechanical issues, and where are you in your stage of healing? Because there are three parts of the frozen shoulder process, and they're all kind of special. Freezing is the beginning. Horrible pain. You could wake up one day, you can't brush your hair. Then frozen, pain's not so bad, but your shoulder's like in lockdown, not gonna move. Then there's thawing. Pain's going to come back again, but your movement's coming. And this is where physical therapy is the most effective to help facilitate it. Here in the freezing process at the very, very beginning, finding the healthcare provider to talk to, such as your doctor, having them look at you, check your thyroid, make sure you're not diabetic, what's going on with your hormones. And technically, the gold standard for treatment is steroids, because steroids reduce inflammation. Now, if it were me and I needed hormones, I personally would take hormones because I think hormones are a big deal. But during the thawing stage, people like me, a physical therapist, are exceptionally helpful because we can help you gain that range of motion. Now, through this whole course of the process, the most important factor is you. Moving your shoulder, trying to gently stretch in the shower, but you have to seek out a healthcare provider. I know a lot of people on this platform, when I say this, have said, my doctor didn't know it was connected to hormones. I know. I know, but you have to talk to your doctor because it will help facilitate the healing process. It is a painful injury. I personally believe strongly in physical therapy for them to teach you a program at home. I have a TikTok playlist on frozen shoulder. I also have a TikTok series, and I believe firmly if we can shorten the time of your frozen shoulder by making sure you're chemically the most optimized version of you and any underlying issues are addressed, giving you the medication you might need to help you control the inflammation and control the pain, and a nice program to help you facilitate healing and maintain/gain range of motion. And this is why a physical therapist talks about perimenopause and hormones, because I bet you didn't know estrogen mattered to your joints.